Good morning, everyone. This is the Allen Care Show. I am Elisa Walker from Allen Hospital in Waterloo. The Allen Care Show is now in our 8th year here on KBBG, and I just want to say thank you to all of my monthly listeners. We want to talk women's health issues and ways you can keep yourself and your family healthy. As you know, women tend to make most of the healthcare decisions for their families. So we'll talk about things that will help you make those choices. We'll also introduce you to the healthcare experts from Allen Hospital, Allen College, and Unity Point Clinic. And we will be happy to take your questions too. I have a very special guest with me today. Her name is Becky Dumler. Now, Becky is a registered nurse who works in the Allen Heart and Vascular Center at Allen Hospital in Waterloo. Now, Becky is going to talk to us about heart disease. Good morning, Becky, and welcome to the Allen Care Show.
Good morning. Glad to be here.
Thank you. Before we get into the nuts and bolts about heart disease, can you tell our listeners a little bit about yourself, how long you've been with Allen, and the journey that you did to get your present position?
Well, I have been a nurse for 45 years. This year I just celebrated that, and I have been with Allen Hospital that long.
Congratulations.
That's a long time. I started out in the cardiac rehab unit, and then I went to a couple different areas of the hospital, and now I'm back in the heart program right now.
Wow, 45 years. I truly have an expert with me today. Becky, where is the Allen Heart and Vascular Center located in the hospital?
Well, this is actually one of the new buildings at Allen Hospital. And where you go to the Allen emergency room, that is the heart center. And the emergency room's on the first floor, and then second floor is all the testing area, and then the third floor would be the inpatient heart area.
Okay. So let's talk a little bit about some fun facts about our hearts. Becky, can you tell us what we may not know or fully understand about our heart?
I surely will. The heart is about as big as your fist, and it is the hardest working muscle in the human body. It does not rest. The only way it rests is at night. Your heart rate will go down a little bit so it doesn't have to work as fast, but it has to keep working. It's located in the center of the chest, and the average heart rate is about 80 beats a minute. And so that means it's beating about 40 million times a year. The
Wow.
more conditioned you are, the lower your heart rate will be.
Okay, and that's the positive, correct?
Right.
That's what we should aim
That's
for.
good. Right. A 70-year-old person then, the heart's going to beat more than 2.5 billion times. And like I said, even when you're sleeping, it's going to continue to work.
What keeps the heart so strong and busy throughout our lives, and how does it keep, how does it keep going?
Well, I always stress the exercise does make the heart muscle stronger, but what feeds the artery or the heart and keeps it alive are arteries, and they're on the outside of the heart, and that's why we really need to protect them. The arteries in the body will always supply oxygen to the heart muscle, and you want these open and clean, and when these arteries start to plug up with a fatty, waxy substance called coronary artery disease, then this will cause the heart to get less oxygen.
Okay, so what is coronary artery disease, and how often does this occur?
Coronary artery diseases will gradually become narrow. They don't just usually plug right up.
Okay.
So when people have a heart attack, these blood vessels become more narrowed, and then they plug up, and this would cause a heart attack or death to that part of the heart muscle. And some people artery disease starts earlier, some people later in life.
Mm-hmm.
It just depends a lot on genetics and lifestyle.
So when we talk about arteries and how they kind of close in, are they kind of wide, or are they like how you are on the highway and then the lines that are on highways and it gets,
More near, that's exactly right. They will just start plugging up and the tricky thing about the heart is you don't know these arteries are plugging up until they're about
Wow.
80 to 90% plugged. You have no idea that what's going on, and then you start getting some symptoms.
oh my goodness. So what are some of the typical symptoms of a heart attack?
Well, there are typical symptoms, and if I had a room full of people,
Mhm.
everyone might say something a little different. But these are, we're gonna talk about the 5 areas that you can have, stuff in, and some people don't even have the 5 areas of pain or pressure. The chest is the most common,
Okay.
and people will describe it when they're having a heart attack. Burning, feels like an elephant sitting on the chest, and a lot of men say this. For about half the women having a heart attack, chest pain is not the main symptom. For women, it's more apt to be back or shoulder pain, or feeling more tired than usual in weeks leading up to the heart attack. Many people with heart attack symptoms will have a feeling of dread, or they just are feeling worse than they have before.
Mhm.
And again, these are symptoms that you should, really stand up and take notice and stop what you're doing and call 911, chew an aspirin, and head to Allen Hospital.
Okay.
Other symptoms beside the chest is going to be radiating pain. Again, this can be different from everybody, but it can go to the left arm, to the right arm, or parts of the arm, like the lower part of your arm.
Okay.
It can go into the neck, jaw, teeth. People that have gone to the dentist and say, my teeth are hurting and they can't find nothing wrong, have ended up having heart trouble.
Mm.
And that's a different one too. And then shoulder blades in the back, between the shoulder blades. And it's rare, but there can be people with abdominal pain. And that, I've seen it, but I haven't seen a lot of it.
Again, with the radiating.
With
just
the abdomen pain.
abdomen
The
pain.
radiating is very common. So
Okay.
we're going to say it can radiate to the arms, neck, jaw, teeth, and back.
So for the average listener, let's say that they don't understand what radiating pain would be. How would you describe that?
I would describe that as maybe it started in the chest, maybe you don't have chest pain at all, but you're going to, a lot of people don't think they're having heart trouble when
Mhm.
their arms are aching.
So kind of tingling?
Yeah,
numb?
tingling,
Okay.
burning, it'll be just a sensation that they have. Some people will say it's downright pain
Okay.
in their arms. But I just want you aware, if you're not having chest pain, maybe
Mhm.
this arm pain or neck pain or jaw pain is going to be related to heart.
Mm.
And so it's just to
It's good
stand
to
up
know.
and take, listen. Another symptom is shortness of breath, and we get a lot of people in with this. Like if you wash dishes, you don't get tired,
Mhm. Right,
But
right.
then let's say now, every time you get up and you're doing some of these low-level activities, you're getting just short, you're getting more noticeably short of breath, more so than you should be. Then this is a change, and this would be when you should go to your doctor.
Okay.
Some people will feel dizzy or lightheaded, feel like they're going to pass out. This is a definite one that should get your attention and get in and get checked. And then a rapid or an irregular heartbeat. And everybody has missed beats. It's just, that's the way it is. But if you feel like your heart's going too fast,
Mm-hmm.
or it's just irregular, and this is happening more frequently, you need to get in. For women, and I want to talk about women because, we don't fit the mold
Right,
of heart.
right.
They had a study where 515 women were having a heart attack. The most frequent symptoms for them were fatigue, sleep disturbances, shortness of breath, and a feeling of indigestion, heartburn, everybody gets that after,
Right.
and anxiety. And most of these symptoms for these women occurred about a month before their heart attack. A lot of times the men, they're a lot more, typical, where women tend to be atypical. So you've got these symptoms, and they've lasted longer than 5 minutes. Call 911. It's the 3 A's: ambulance, aspirin, Allen, and that will save heart tissue. That's why it's so important if you're having a heart attack.
Becky, can you reiterate the importance of jaw pain? Because I'm just thinking of, when someone has jaw pain, the first indication would be, oh, it's a tooth.
Right. Jaw pain can happen in both men and women, and it can be jaw or throat. And the pain would feel like a tightening.
Okay.
And then, like I said, some people will feel like the teeth are achy. And again, some of the ways you would know it's not your teeth is if you sit down and rest, it goes away. It's probably heart.
Oh, okay. You sit down.
Toothache is a constant, will be a
Constant.
constant thing until you get it taken care of. So, this is different. Anyway, Allen is one of the nation's top heart hospitals. And this is really, something to stand up and think about. But
Yes.
in the United States, we're one of the top 50. And just think of all the states and all the bigger cities that are bigger than us and all the bigger hospitals. And we're designated as a top 50 heart and cardiovascular hospital. And we were really impressed and felt really proud when we got it in 2013, but we were awarded again in 2014, and that almost never happens.
That is great. And then also, I know we talked about the 5 typical symptoms. Have you noticed any atypical symptoms or something, that is rare but could associate itself with heart disease?
The typical is chest pain with maybe, radiation or not, and then jaw pain. The fatigue thing, who isn't tired?
Right,
We work
right.
hard, but it'll be more, and a lot of people will not associate that until they're in the hospital, had the heart attack, and they think back and they go, my goodness, I was so tired, and I was taking more naps and taking more breaks, and then that shortness of breath.
And I think that's a good point because, a lot of people are tired, just of the normal routine of a busy day. But when you say, fatigue could be associated with that, is it a different type of fatigue where you just want to lay down?
Well, you do the things you normally do, but you just get really tired, and you might even start doing less. You're thinking, I'm just too tired to do this.
Like maybe going from like the kitchen to the living room.
Well,
And you're
it'll be usually with chore or stuff you're doing.
Oh, okay.
And so, you're thinking, I'll maybe do this tomorrow, I'm just too tired. But, things come on so gradually that sometimes you think, well, I'm just getting old.
Exactly,
And
exactly.
that's not true, so.
And what about, how does nutrition play a key? Or does it play a role?
Oh, we have you need a heart-healthy diet, and this will be a risk factor modification. And so, it's watching how much red meat you eat, watching eggs, cheese. And you can have these things, but you're going to eat less of them and eat more white meat, turkey, things like that.
Okay. Our guest today is Becky Demler, a registered nurse who works in the Allen Heart and Vascular Center at Allen Hospital in Waterloo. Becky is going to talk to us about heart disease. When we come back, we'll learn more about the important service to our community. I am Aliza Walker, and this is The Allen Care Show. Welcome back to The Allen Care Show. Our guest today is Becky Demler, a registered nurse who works in the Allen Heart and Vascular Center at Allen Hospital in Waterloo. Becky is talking with us today about heart disease. Becky, before our break, we was going over the top 5 typical symptoms of a heart attack. Let's kind of move a little bit into doing something a little bit different right here. We're going to do some we'll call it role play it.
That's right. I would really like to do this, and I would like our listeners to think in their minds what they would do if they themselves or a loved one was having a heart attack. And the reason we do this is if you go through in your heads what you would do if the time would ever come that you were having a heart attack or your loved ones would, you would know what to do. So while our listeners think it over, let me ask, what would you do? And we're going to talk about each step and then say why it's important. So listeners, I want you to get in your mind, is it you having a heart attack or your loved ones? And I'm just going to talk you through each step. And, I'm hoping things would be easier for you. The first thing is, let's say you've been having symptoms off and on for a couple weeks. The pain in the chest, arms, neck, jaw, back, that comes and goes and doesn't stay long. Now the symptoms are staying, they're not leaving. Shortness of breath. Some people will get like a cold sweat on their skin, short of breath. They don't feel good. And in your mind, you know something is definitely wrong. And so what are you going to do? There's, your loved ones, you look at them and you go, boy, you don't look very good. What are we going to do? So right now you're identifying what the symptoms are and what would you do. Okay, the next thing that you're going to do is pick up the phone and dial 911. And I don't know if people have called 911 before. The operators are great. They are going to want you to stay on the line. They're going to ask you a lot of questions. You've got to know, give your address so they know where you are. They will have you probably tell you to go get an aspirin and give it, either yourself take it or your loved ones. You're gonna have to make sure that the doors are unlocked, so you'd have to unlock the doors. And if it's night, to even think about putting a porch light on would help. But this is just sitting, and sometimes I think, you think, oh my goodness, I've waited here. And then when you look at the clock, it's only been a few minutes. Our ambulance people here in town are just, they're fantastic. So the ambulance will come, and the lights are going and stuff, and but they will come in, and there's 2 people, and they're going to hook you up to a monitor right away. They're going to talk to you, they want to know when your pain started. This is important. When did this pain start? Because what they're going to do when you get to the ER is when your pain started. Because there's such a window time that they can do something. So they're going to say, when did your pain start? They'll probably put oxygen in your nose. They'll start an IV, and this is important because they can use emergency medications at this time. If you have a medication list or for your loved ones, or people should carry these lists in their purse.
Yes.
I
That's
want to
very
say
vital.
that because
It's
by
very
the
important.
time they call pharmacies and get lists and stuff, so you should have a medication list. You should, or just grab your pills and bring them with you, and they might do that too. So the hospital knows what you've taken and all this stuff. Okay, let's say in our minds now that you are having a heart attack. That they put you on a monitor, they've called the Allen ER, they're in constant communication with the emergency room, and so they know that you're having a heart attack. And so there's different things that they do, but they call what's called a STEMI alert. And what this means is, this is alerting our emergency room, this is alerting the cath lab people, this is alerting doctors that this is a heart attack happening now. And so You go into the ER, then ambulance will take you into the ER, they'll put you in a room, hook you up again to the monitors, and then whatever the doctors have ordered, they're gonna do a 12-lead to make sure, yes, this is happening, and they can tell from EKGs if this is a EKG or a heart attack happening now, or, is it one you had 2 years ago? They can see that because it's a scar on the heart. So then you'll go to the cath lab, and you have a 90 minutes from door to opening this artery or ballooning this artery. And this is where we get to be one of the top 50 hospitals in the nation. You'll meet the cath lab people, and they're again very good. They're very good at what they do. You'll go into the cath lab, and this will be a whole nother story talking about heart caths, but they will get that artery, look at which one's closed, and then they either balloon it open, put a stent in. And of course, you'd then be admitted to the hospital.
And how many stents could be inserted at one time?
I've seen a lot of stents, put in like 4 in one artery if it's a big long lesion. Usually it's only one that they need. They will have an area that's closed off. And if they wouldn't have opened this artery, then that part of the heart muscle would have died, and you would have had a heart attack, permanent scar on the heart. But by ballooning this open, they get it open, and this blood can flow and feed the heart. And then you'd go, you'd be admitted to the hospital, and then, recovery, you'd eventually go to cardiac rehab, where they will help strengthen the heart and get you back, and education and everything you need to know. But, in your mind, I think if you go through these steps, if it would ever happen, you've already done it once in your mind.
Right.
So you could do it then.
And it's good to do this role play just because everything happens so fast, and you want to, again, get that mental picture on what I do, just like performing CPR.
Right.
If we do it on a routine basis in our mind, then when it comes to action time, we'll really know what to do. And I like the fact when you said leave a porch light on and the door open.
Right.
That is so
Right.
important.
And the 911 operator will really tell you, ask you until that ambulance gets there. That's your lifeline.
So
you
they'll
wanna
stay on the
line.
phone with you,
Yeah.
stay on the line with you.
Yeah. So it's a good way to think about it. I hope none of my listeners ever have to go through this, but if you do, it's just think fast, act fast. Now, what if you got there and everything was normal?
I like to celebrate.
Yeah, there you go. People always say, well, I hope I'm not going in and they don't find nothing, and I'd say, I hope you're going in and they don't find nothing. So yeah, it's, but most people that are having this have something. They know, and you guys, if this is happening to you, it's like a sense that you
Yes.
know something is wrong. It's that dread feeling.
Because we don't know their bodies like they know their bodies.
No.
So it's hard for us to say, okay, your pain level is at a 7,
Yeah,
when it really could be at a 15.
yeah.
So,
It is, and the more heart muscle you sink, the better you are.
now as part of the cardiac rehab, is there like a certain amount of time that they participate in cardiac rehab? And what exactly are they learning through that process?
Cardiac rehab is really an awesome program. You come in and you have heart classes which go a lot more in depth than I have today. Learn to eat and exercise, and a lot of people, they want to get you to exercise and not have any problems since you've had all this with the heart. And they usually go about 36 sessions and come 3 times a week.
Oh, 3 times a week for 30. Okay, that's great.
So it's and then they can go on their own and exercise safely and know that everything's okay.
Now, Becky, you mentioned earlier that Allen is a top cardiac hospital, one of the top 50 heart and cardiac centers in the country in 2013 and current 2014. Now again, before you run out of time, why is it so important for people to get to the emergency room of a heart hospital when they're having chest pains? What's the difference?
Well, you know, there's different levels of hospitals and there's different levels of care. Some hospitals have absolutely no, cardiac units. They don't have cardiac catheterizations, anything like this. So you have to go to a heart hospital if you're going to have something done. The other hospitals, all they can let you do is have a heart attack. Now, these hospitals have been trained by hospitals, our hospital, to recognize, to send things to them. And so we get ambulances from all over coming in to bring these patients in. And the whole reason is they are saving their heart muscle, so it's healthy.
Finally, Becky, how and when can people get in contact with you if they have chest pains? Where do they go? And will the hospital be ready for us when we arrive with chest pain?
You really don't, you can, if you're having chest pain, you don't have to call, just 911. If they need to get in touch with me, like I'm a working on the floor nurse, I'm at 235-3800 if they have questions for me. But if it's about them, they need to get into the emergency room. And also talk with your doctor, maybe if you're not sure. I mean, I wouldn't call them first, you call the ambulance first, but in just like your general physicals, bring up this subject.
And our motto is, when in doubt, come, let Alan figure it out.
There you go, I love that.
You've been listening to the Alan Care Show, a show for women and their families. My special guest today has been Becky Dumler. Becky is a registered nurse who works in the Allen Heart and Vascular Center at Allen Hospital in Waterloo. Becky has been talking with us today about the importance of heart disease. Again, Becky, thank you very much for joining me on the Alan Care Show.
Thanks for having me.
And I want to say Happy Easter and Happy Good Friday to all of my wonderful listeners. Join me for my next Alan Care Show on Thursday, May 15th at 10 a.m. right here on KBBG FM.